Now, the time for your athlete to play their favorite sport is quickly approaching, but before they lace up, here's some advice I learned from health officials to help keep your athletes safe during their big games. Before your child brings home the big trophy, they'll need to get cleared to play the big game.
Most schools require that you get a sports physical to be cleared to play in the season.
Providence's Kristen Filer tackles the importance of a sports physical.
Screen for pre-existing illnesses and underlying injuries, especially life-threatening ones, things like heart conditions or asthma issues or allergies like a bee sting. Do these kids have their EpiPens? Do they have their inhaler? Are the heart issues managed? Have they been seen by other doctors that can clear them for them? But they can also detect for factors that can increase their risk for injury out on the field.
Whether you're swimming, running, passing, or scoring, assessing your risks for injuries is something every good athlete should do.
Do you know how to use your inhaler? Is there someone that is always going to be on the field or around that knows how to help you use an inhaler when you're in this crisis and you're having trouble breathing? So making sure that there's a really good plan in place is really important for these kids because a lot of injuries will go undetected throughout the whole entire year.
Your pediatrician will be your MVP throughout your sports season, but before you gear up, doctors say a visit before the season couldn't hurt.
Ideally, you want to do them 6 to 8 weeks prior to the season. I know that's a really long time out, but it really allows to treat any issues, rehabilitate those issues or injuries, and then come back in for reevaluation and make sure they're cleared.
So if you don't already, set up an appointment to see a primary care physician. That relationship will establish a baseline for your medical history, and your doctor can help you take home the gold.